Alright, today's episode, the pending airway failure. Dispatched on an adult male complaint today is going to be difficulty breathing. You arrive on scene, the patient's awake, anxious, tachypnic, approximately 40 breaths per minute, able to speak 1 to 2 word sentences, really appears to be struggling to breathe. First thing you do is you apply your non-rebreather. Patients or your EMT partner is going to check with the family, get a history for you. Patient has a history of COPD and CHF, does have high blood pressure, and occasionally takes a water pill. Listen to lung sounds. They are extremely diminished. You are unable to differentiate between clear lung sounds, rhonchi or rales, or wheezing due to environmental issues. No real change with the non-rebreather. You're going to apply your cardiac monitor as you're preparing to set up your CPAP. Monitor's applied. Looks like he's tachycardic in the 130s. Initial SpO2 is 81%. Respirations are currently at 38. Shallow and labored. Discontinue the non-rebreather. Going to apply the disposable CPAP device. Mask is applied, high flow oxygen. This portable CPAP device runs an FiO2 of 30%. My initial PEEP setting is going to be 5 of PEEP. And the initial response I get to the patient is I get a slight decrease in the heart rate and I get a slight increase of SpO2, which would be suspected. I work on establishing IV access. I do a 12 lead that's been negative for any ST abnormalities. No other identifiable acute findings are noted. A few short minutes later, again listen to lung sounds, still not very identifiable other than they're diminished throughout. I check with my patient here after a few minutes of the CPAP, and my patient is noticeably less responsive. Respirations have diminished drastically to about 8 a minute. Cycle my blood pressure, see if there's any change in there. Heart rate still is in the 120s, 130s, science tack on the monitor, so no change there. Patient responds to verbal stimuli, really unable to follow any commands. When you touch the patient, shout at the patient, they will open their eyes, but really no other commands are going to be followed at this point in time. So with the decrease in respiratory rate, I'm going to discontinue the CPAP. CPAP's been discontinued. I'm going to go ahead and apply a BVM, high flow oxygen. We're going to assist his ventilations at a rate of 10 to 12. And we're going to lower the patient so that I can maintain a good mask seal. So we're going to ventilate here at about 8 to 10. Going to look at my vitals, see if anything is improving. Nothing's really changed yet. Heart rate's actually increased a little bit. SpO2 is still in the 80s. Blood pressure is a little elevated in the 170s. What I notice is that it's increasingly getting difficult to ventilate this individual. Having some issues getting a proper mask seal. I do feel some pretty good leak of air. We're going to continue with this treatment just a little bit longer and see if anything else changes. Nope, still in the 140s. SPO still is in the 80s. So my thought process now is that eventually I'm going to need to place an airway. So I'm going to have my EMT partner set up all my intubation supplies along with a backup airway. And I'm going to set up all the important medications, the paralytics and the sedation medicines. Your service, your choice. For me, this procedure, I'm going to use rocuronium and etomidate. Those are the two that are readily available in the services that I use. So we're going to go ahead and push both of those drugs. The patient's already becoming less responsive prior to the medication administration. Going to go ahead and discontinue the BVM. I got my tube ready. Straight blade number 3. Everything works on my end. I got end title prepared. And I have suction prepared. Suction's on over here. Gonna insert the blade. Oh man, he is just full of fluid. I'll go ahead and pull out. We're gonna suction for a little bit here, try to clear some of this mucus. Looking at our vitals here. Heart rate still in the 130s. Oxygen saturation's in the mid 80s. Second attempt, we're going to displace this tongue. Still unable to identify any real landmarks. Just can't see anything. We're going to pull out. We're going to suction one more time. Try to clear the back of the airway. Now we're going to resort to a backup airway. In this instance, we're going to use an eye gel. Eye gel is lubed. Eye gel is inserted to the right depth. At this point in time, I would secure this in place. Apply my end title. Apply my BVM. I notice his heart rate is slowing down here a little bit. SpO2 still in the 80s. Recycle of blood pressure. I do still have a carotid pulse. So post intubation, looks like my first set of vitals, heart rate is 63. SpO2 is 81% with a good pleth, and blood pressure is currently assembled. So what happened? Why the decrease in heart rate? Why the decrease in saturation levels? And ultimately, the decrease in blood pressure.